Guys, right to go? Very good. I'm joined today by Jerome Weimar again, who is the testing commander at the Department of Health and Human Services, and research manager Nick Crosby from Melbourne Water. We're going to take you through in a bit more detail some of the wastewater testing and what that's achieved to this point and what it may mean for communities in coming weeks and months. Before I ask Jerome and Nick to speak to those issues, I can confirm there are now 19,688 aggregate confirmed cases of coronavirus in Victoria. That's 76 new cases since yesterday. There have sadly been now 694 Victorians who have passed away because of this virus. That's an increase of 11 since yesterday's report. One female in their 60s, 3 females and 2 males in their 80s, 3 females and 2 males in their 90s. Of course, we send our best wishes and sincere condolences to each of those 11 families. 9 of those 11 deaths are linked to outbreaks in aged care. There are 196 Victorians who are currently in hospital. 20 of those are receiving intensive care, and 12 of those 20 are on a ventilator. A total of 2,428,778 test results have been received, which is an increase of 16,686 since yesterday. So those numbers are obviously much higher than yesterday's number. And again, we'll simply issue the plea to all Victorians, regardless of how mild your symptoms are. As soon as those symptoms begin, please come forward and get tested. It makes a massive difference, and it gives us the certainty, the data, the clearest picture of how much virus is out there, and that allows us to move in safe and steady steps towards finding that COVID normal. And thank you so much to all of those Victorians who have been tested, and those who, as we speak, are making their way, or will later today, to one of the more than 190 test sites across the state to get tested. It's a massive and powerful contribution to our collective fight against this virus. There are 4,337 cases in total of unknown source. That's a decrease of 7 since yesterday's report. There are 252 healthcare workers who are active cases. We send our best wishes to them, and of course all Victorians who have this virus, but a special mention and a special thank you to all of those healthcare workers for the amazing job that they're doing in very, very difficult circumstances. There are 1,622 active cases in Victoria, so those numbers continue to steadily fall. In terms of regional Victoria, there are 82 cases in regional local government areas under the Stage 3 restrictions. There are 7 new cases today, but the total number, because of course as people recover they come off the active case list, but there are 7 new cases in regional Victoria. In general terms though, regional Victoria case numbers remain very low, and we are very grateful to each and every member of regional Victorian communities who are playing their part to keep those numbers low, so that we can meet those trigger points and be able to not simply take 1 step but potentially 2 steps in regional Victoria to open regional Victoria up. That's not for today. There will need to be further days elapse for us to get to that point, but the numbers are encouraging. The overall picture in regional Victoria is very encouraging, and we thank everyone for the important part they're playing in delivering those lower numbers. In general terms, Colac has 30 active cases, 5 new. Greater Geelong has 15 active cases, 1 new. Greater Bendigo has just 2 active cases and no new cases, and Ballarat has no active cases. So when you think about the picture, only a few weeks ago, more than 500 cases across regional Victoria. We are now down to 82 active cases, and that trend is certainly with us and moves us closer day by day to being able to ease restrictions in regional Victoria in a safe and steady way. The metropolitan 14-day rolling average is 74.5. The regional Victorian rolling average is 5 cases. That means across the board it's an 80.8 average across both regional and Metro Melbourne. Active cases in disability facility settings, there are some 17 of those, 11 in staff, 6 in residents. So there is some significant stability there, and indeed numbers are coming down, which is very important given the vulnerability of so many in those settings. Aged care active cases, there are now 829 currently active cases. The same can be said there. Those numbers are, well, they've stabilised firstly and now they are falling. That is very important, again, given the often very tragic outcomes from uncontrolled outbreaks in aged care settings. Just finally from me, in terms of updates, we had some questions in relation to worker permits. So I can now confirm, following many questions that have been asked about the status of permits, permits will need to be reissued over the next few weeks as the dates on them expire. There will be some further advice put up on the website later today, but employers will be able to use the template that they've already got. They can simply amend the dates on it and reissue based on those steps. We will provide, and the different categories that different industries find themselves in, we'll have some further guidance. We've tried to make this as well, try to reduce the administrative burden as much as possible. But if those permits are going to be accurate and effective, particularly for the purposes of curfew, then they do need to be reissued. When it comes to childcare permits, though, those did not have a date on them, and there's still a couple of weeks to run in terms of the, we hope, the likely shift once we reach that 30 to 50 case trigger in metropolitan Melbourne. These were not dated though, so there will not be a need to reissue those. They will be live and current for as long as they need to be. If we could find a way where employers did not need to reissue permits and still have them valid, still have a degree of formality with them, they need to be contemporary. They need to represent exactly who is working and the circumstances under which they are working, so that police have got the clearest and easiest sense of who should be out and about, who can be out and about after curfew. Therefore, they need to be remade. There'll be some further advice on the website later today. I now might ask Jerome and then Nick to speak to wastewater testing. I think it's fair to say that we are doing this in a leading way, not just in Australia, but some of the stuff we're doing is truly world class. And every tool, every mechanism that can be used in order to try and stay a step ahead of this virus, particularly in regional Victoria right now, but in metropolitan Melbourne as numbers continue to fall, will be very important, and that's why an enormous amount of work has gone into trial and make sure that the efficacy of this is up to scratch. It's just one example of many different continuous improvements that we've made, many different approaches, and trying to be as open as possible to looking at different ways of doing things that serves us well, and certainly will be of even greater benefit once we get down to very low numbers and the strategy is absolutely reliant and dependent on keeping those numbers as low as possible. So I might ask Jerome to add to my comments now.
Thank you, Premier. A critical part of our ongoing approach is to provide continued surveillance so we all remain vigilant to the ongoing threat of community transmission across both regional Victoria and in Metro Melbourne. Since earlier this year, we've been working on a research project to use wastewater, sewage, to test for viral fragments of coronavirus. We've now got that piece of development work to a point where over the last 2 weeks we've been able to operate across 25 surveillance sites across the state, some in Metro Melbourne and some across regional Victoria. And what we're doing on a very regular cycle, we're taking samples at those 25 sampling locations to see if there are any changes in the level of coronavirus present in the wastewater. Apollo Bay is particularly interesting. Apollo Bay was, of the 25 sites, the one location where at the start of the work 2 weeks ago there were no positive traces at all of coronavirus because we've had no confirmed cases to date in Apollo Bay. Then on the 1st of September we picked up the first positive sign of some traces of coronavirus in the Apollo Bay water catchment, and we picked it up again a second time on the 5th of September. I'm really grateful to all the residents of Apollo Bay who've come forward over the last few days to get tested. We encouraged, as of Friday, Saturday, people to come forward if they had any remotest symptoms within the Apollo Bay community, and I'm pleased to say that people have come forward over the last few days to do just that. To date, we've had all the test results back apart from 9. 9 of the tests due yesterday. We'll have the results later on today. To date, all those tests have come back negative. But we continue to implore people to ask them if you are in the Apollo Bay area and you have any remote symptoms of coronavirus, please come forward to get tested. And it is all part of, it's yet another one of our ways, or one of our tools that we can use to ensure that we maintain a high level of testing across the Victorian community. And as the level of cases reduces, as the level of community transmission goes down, we need to be ever more vigilant for looking for those remaining cases that are out there and getting to them as quickly as we possibly can. So again, for people in the Otway area, if you have any remotest concerns, Otway Health, McLaughlin Street, there's a 7-day testing centre there, one of more than 200 testing centres across the state. I would encourage you, please, to go and get tested, and we'll continue to be there to support you to make sure we get to the bottom of this. And that we are also, of course, continuing our encouragement as the number of cases goes down for people to continue to focus on those locations where there are still potential exposures. Every day on the DHHS website, we now identify potential exposure sites based on the previous day's cases. You can go there. I would encourage Victorians, please, regularly check on that website, check on those potential exposure locations, because it's important that if you've been in those locations and we know there's been a positive case in that area, that if you have any symptoms, that you do get tested. And I would also, again, encourage people that, as we've said all along, this is all about people who, at the very earliest signs of having any concerns about their health, of any early signs of this condition, please come forward and get tested. The network is there. The waiting times are very short. We are now getting almost 90% of the results back to people within the first day. I'd like to particularly appreciate the people of Altona North. We encourage people in Altona North to come forward over the last few days. Again, we've seen some disturbing cases in the Altona North area, some very good work with local community members, local community groups, and Hobsons Bay Council. And I'm pleased to say we're seeing a number of people in the community now coming forward to get tested. All of that, as the Premier has said, enables us to get on top of this and to get on top of the coronavirus at its very earliest stage. So I will now hand over to Nick Crosby from Melbourne Water. Nick's been leading the research stage of this study, understanding how we can best optimise this new tool in our armoury. I can explain the technology behind it and how we're going to roll it out from here on in. Nick.
Thank you, Jerome. Thank you, Premier. Well, this is an approach which has been tried before and has been successful in the surveillance of polio all around the world and has enabled Australia to maintain a polio-free status. So, in fact, it's not a new approach. Its attraction is that you can screen a large number of people by taking a relatively small number of samples. So in our case, we are currently testing at about 25 locations, and that gives us somewhere around 70% of Victoria's population. As the Premier said, if you don't expect cases but you find traces of the virus within your sample, then that can prompt health to follow up with further action. So we do think that this is an approach which can add real value cost effectively, and we've been very careful to make sure that it's extremely well validated and we can trust the results. And with that, I'm prepared to take questions around how the approach works and any other technical questions.
Once case numbers are much lower, I'm assuming in the Melbourne sewerage system it's so broad that if you find traces, you can't then try and localise that to particular suburbs?
That's a very good question. We are working on a Sentinel system, but it's at this point in conceptual phase. So it could be that we could have a rapid traceback, but that is still a research endeavour at this point. In a large, you're quite right, in a population of 5 million, we do have 2 large treatment plants. One covers about 2 million, one about 1.8 million. So if you get a detect, it will be very challenging to find an individual or a small cluster without an efficient traceback.
Is there the potential to do testing further up the system, I guess, before it gets to the wastewater?
Indeed there is, and it's all about how do you allocate your sampling most effectively. And that's something we work closely with the health department to ensure that we are sampling at the most optimal locations. But yes, it is possible to sample right up in the network.
So at the moment we're just doing the big wastewater plants in Melbourne?
Principally, we're at 25 locations. There are 14 regional treatment plants. In Melbourne, we have 9 network locations as well.
And where are they? At the treatment plants? Or?
I can provide you the list. Do you want me to actually read them out? They're within the network, in various locations within the network.
So
Yep.
from one of those 9 locations, you can pinpoint a few suburbs at least, can you?
That's right. Yeah.
How broad's the area connected to each of the 9? Like, is it 10 postcodes, 3 suburbs?
They're large areas, and the traceback challenge is quite substantial in a large population. Yep. At this
So
point,
Most effective, it sounds like, in regional areas like Apollo Bay.
the jury's a bit out on that, but probably yes.
How kind of up to date is the testing on how active the cases are? Is it more like I read here that it might fall off your fingers or things like that? Is it more going to pick it up kind of after the worst of the cases has passed? Do you know what I mean?
So, I mean, it starts principally in the bathroom, right? Many people who are infected will excrete in their stool. It can also be washed off their hands, or if they're using facial tissues, they might discard those facial tissues in the toilet. Then there's a timing issue. If there's just one person in a catchment, then the sewage makes its way to the treatment plant, and then you have to sample at a certain time to be able to detect that. In small locations, then the transit time might be as low as 30 minutes. In locations like Melbourne, then it's between 8 and 12 hours. But we do mostly use auto-sampling, which assists us with the sampling, in that we are sampling over a 24-hour period once an hour, and then we composite that into one pooled sample.
How accurate is this testing from wastewater? There have been traces of coronavirus found in Apollo Bay, but no positive cases yet. Is it possible that these are false positives, for example?
I'm pleased to say that the method is very well validated. So from an analytical perspective, we are very confident that the result means that we've detected the virus fragment.
So there is someone in Apollo Bay or who has...
Someone has excreted coronavirus at some stage in the catchment of Apollo Bay. I'll defer to health on any significance of that result, but as I said, our method is very well validated, and it means that someone at some stage has excreted coronavirus into the catchment.
Can I just ask Jerome a question about the exposure sites? Just looking at the exposure sites today, there's 4 on the Victorian Department's website. New South Wales has got 11 get tested now locations and 40 monitor your symptoms locations. Mm-hmm. And they clearly don't have nearly as many cases. Mm-hmm. Why do we have so few sites listed?
They're open, Raf. They've got pubs and clubs and restaurants and other venues open.
That's right. So we are at the stage where we have some very well established high-risk locations and high-risk clusters that we are continuing to drive on. And remember, we are still at the stage where, although the number of cases are coming down, we still have a ways to go to get to the stage of New South Wales with still a high level of community transmission, as shown in the results from yesterday. So we are targeting and we're asking people to be alert to those locations where we're currently particularly concerned. We obviously have a lot of ongoing work happening within the aged care sector. We have a lot of ongoing work happening within high-risk industries. We have a lot of ongoing work happening within the north and western Melbourne. So we will continue to see, as the number of cases goes down, we will start to see more specific locations being brought to people's attention to encourage people to come forward in the way that we've done today with the call-outs around Altona North and the call-outs around Colac.
And I don't know if this is a question that can be answered, but Brett Sutton was saying last week, you monitor people who've got symptoms and about half of them weren't getting tested. Do we know if that has improved?
Yeah, that's not something I can comment on. I can comment on the testing program, RAF, and how we're going with that, but not on the clinical side.
So just on Apollo Bay then, what happens from now? You've had testing over a couple of days, 60 people have come forward, no positive cases, which means that person is still out there. Do you now do the door-to-door thing that we saw in suburban hotspots earlier, or what happens from here?
So we've still got a number of tests that we're processing right now that came out of the testing we've done in the last few days. The testing centre remains open, and we're continuing to work with the local community and with the local council around encouraging people to come forward, again, if they've got symptoms. So we'll continue that focus over the coming days. We're not at the stage yet where we feel we need to go door-knocking, door-to-door on every single household within Apollo Bay, but we are continuing to reiterate our message to people. We need you to come forward if you feel you've got those symptoms.
And do you know if you measure the time between the test and the contact tracing interview? I know the national dashboard doesn't require that. It just seems that would be quite an important thing to try and reduce. Do you know if the department collects that, the time between when someone gets a test and when they're interviewed for contact tracing?
Yeah, and like, as the Premier said yesterday, we are now starting to produce a much more detailed dashboard on a very regular basis from the department around a number of key metrics. There are two key metrics for us in the testing and the contact tracing side of the house. There's obviously the time it takes for you to get your test result after having it tested. Pleased to say that last week those numbers are now at 88%. People of results coming out within a day. That's the highest number we've seen for a while as we continue to improve the system. We'll continue to improve it from here on in. The second data point for us is around at the point of a positive test to completing contact tracing within 24 hours. Again, that's now hitting towards close to 100%. So put those two together, we're aiming for that magic 48-hour timeline to get through to all these people.
I understand that, which is the answer. I appreciate I asked you that yesterday on the radio.
Yep.
It's not clear to me because that's two separate metrics. Maybe I'm asking a question that is relevant and unimportant, and please tell me if that's the case. It just seems it would be obvious to me that that's the timeline you want to reduce. If I go and get tested tomorrow, and I'm not, my contacts aren't contacted for, say, 72 hours, that's the metric you want. Is that single measure something you're attempting to measure?
Raf, there is a critical 48-hour period between when the person takes the test, so the swab, to when the case is closed. And there are lots of different component parts to that. So, for instance, how long does it take to get the swab from the retail testing site to the lab? How long does it take the lab to process that? How long does it take to then get that advice to DHHS? How long do they take to contact and interview the case and then contact the close contacts of that positive case? In a perfect world, then you would have 100% of people, that whole process would go no longer than, say, 48 hours. That would be well and truly above the experience of the vast majority of countries across the world. We're working towards trying to find, as I've said a few times, I don't think there are hours and hours out there for us to find.
No, I understand.
But they're not quite. And part of, although let me come back to you on exactly if there is something we can provide you, then we're more than happy to do it. That's the aim. But I don't think we've quite settled yet on what's a realistic percentage. And I had a very detailed conversation with Alan Finkel this morning before coming in for this about those very issues and whether is it a realistic number at, say, 75% are closed out, swab to close out within 48 hours? Is it 80%, 90%? It's almost certainly not 100% because, of course, there's always a handful of people that you can't get to for whatever reason. I think that task becomes, well, it's never easy, but it becomes easier the less cases you have, and it becomes more important to get that percentage up as high as you can, the less cases you have. But on the metrics that are the agreed National Cabinet metrics, so every case contacted and interviewed within 24 hours of us being notified, and as Jerome's just indicated, laboratory time has come right down, and we're doing just simple things like doing multiple courier runs, so not waiting for a whole day's samples to pile up and then sending them all off to the lab. They're being sent multiple times during the day. That's been going on for a while, and that does find you hours. So that's in the 90s. That first metric, there are a number of people that you just can't find, despite our best efforts. Door knocks, multiple door knocks, phone calls. Then there's the second category of the close contacts within 48 hours, and we are very, very close to 100%. I think that my last look at it yesterday, it was 99 point something. So it's a tiny number of people that we can't make contact with.
Do you think, pretty furious debate since you released the plan. I'm not asking you to comment on the debate itself.
Sure.
Because you're pretty clear on your plan. But do you think that the nature of the debate reduces compliance? Because a lot of people are angry and there's a lot of criticism aimed at you. Do you think any of that stops people following the rules?
No, that's part of this job. All I'd say to people, if anger and frustration were like a vaccine against this virus, then we'd all be in a much better position. And I just say to people, the notion that I have chosen this way to go and there were 50 other options I could have chosen, that's not in any way accurate. We'd all like to be open tomorrow, myself included. But to do that is not an act of leadership. That is to cave to some of the pressure that's there, to be driven by the anger instead of the epidemiology, to be driven by opinion instead of science and data and doctors, That is not what I'm about. Because what it'll mean, Raf, as I've said to you collectively many, many, many times, and I'll continue to say to Victorians, the worst case scenario here is being open for 2 or 3 weeks, and then I'm here not reporting 70 or 50 or 30 or 20 cases, I'm reporting 200, 300, 400. It's gone again. Because the thing about it is this, just like anger and frustration is not a vaccine against this, although I understand why people are frustrated and angry. I'm not quibbling with that. I'm not criticising people for feeling that. But just let me finish the point. On the issue of contact tracing, that's not a vaccine either. It's about limiting the spread. It's not about eliminating the spread. It gets very, very challenging, particularly when you've got large numbers. Now, at smaller numbers, and this is the point around the wastewater testing, Laura made the point about regional Victoria. Absolutely, it'll be of amazing importance in regional Victoria for a long time. We will get in Melbourne to a point where the numbers are so low that it'll have a similar effect to regional Victoria. Not so much in being able to isolate down to a small group of suburbs, but it'll validate that yes, it's still here. It's on this side of town rather than the other, and then that'll be able to inform us asymptomatic testing in high risk workplaces, where if it's out there and it got into them, abattoirs for instance, it could take off again. Or just those general warnings about if you've got symptoms, we've found it in treatment plant X, please go and get tested. So it'll have a utility across the whole journey, but it'll get more and more important the smaller the numbers are.
Can I just ask something about the anger and frustration? And again, I
That's
know
fine, yeah.
you're not telling people not to do that, but I'm just curious because in a normal political conversation, you only have to persuade a majority. But the people who are, I guess, are angriest, you actually need them to comply and do the right thing in the same way. Do you think there's anything else that you could do or should do to reach the people who are
Sure.
criticising you the most fiercely? Because it's public health, it's not politics.
Well, let me deal with the first part of your question. This is not normal, that's the first thing, and this is not a political discussion. It's just not.
Absolutely.
Politics has never been less important to me and the fight that we are all in. If your party allegiance, if your frustration, if your anger, if your sense of weariness with the predicament we're in were effective in fighting this virus, well, that'd be a terrific thing. It isn't. On compliance though, on the level of compliance and people staying the course, we've seen some particularly selfish behaviour from some people, and I'll again make the point, as I have many times, it is unfair, it is wrong to look at the behaviour of some and use that in any way to take away from the amazing job that the vast, vast majority of Victorians are doing. People, I think, it is possible to be angry, to be frustrated, but deep down to know that the only way out of this is to follow the rules. And I think many, many Victorians are doing just that. They are doing the right thing. They're playing a massive part in our collective fight against this. But at the same time, they're not pleased to do it. I've tried to acknowledge that as frankly and as often as I can. No one's pleased to be under these rules. But opening up for a short time and then not being able to stay open, that won't do much for anger levels or our fight against the virus either, is the point I'm making. I don't get a sense that people are not following the rules. I think people know and understand, as difficult, as challenging, as it's by no means the preferred predicament to find yourself in, but you can't ignore the reality that we face. That is no answer.
Can I just ask one more time? Sorry.
Sure.
The modelling didn't model a gentle easing of restrictions. It didn't model, say, a stage 3 plus masks. And it also didn't include where our contact tracing is right now. So some people are very upset. They think, well, hang on, if you didn't actually model something that is close to where we could be, not this stage 4,
right,
why then trust the modelling and why use it to set such harsh expectations for the lift out? Can you respond to that criticism?
Well, I don't accept that the modelling didn't take into account, as you say, a more gentle easing, which I think by which you mean.
It didn't model a stage 3 plus masks.
But it did model, for instance, opening up even in a staged way at 25 cases per day. So the notion that only the lowest tolerances and the lowest thresholds have been used to model out is wrong. We modelled 3, 5, 10 and 25. If at 25...
That's cases.
Yes, indeed. Plus some community transmission cohorts within that. At 25, and if by easing more gently you actually mean easing faster, obviously we will get to 20...
I didn't mean case numbers, I meant by easing to something like a
Right,
stage 3 plus
well,
mask, why not model
yeah, but
that?
the problem is you can't. Yeah, but the problem is you can't get around the case numbers. Case numbers are absolutely everything, and if you, what we know, and we'll get to 25 before we get to 3, obviously. If you opened up sooner because your case number threshold was higher, then you've got a 65% chance, about 65% chance that we're back into really tough rules, really harsh lockdown again, quite soon, with all the challenges that come with that.
But the modellers have said you could model stage 3 plus masks. They weren't asked to model that.
Well, look, what I'd say to you is this, and I've tried to make this point a few times. We've got an amazing scientific and medical community in Melbourne and across our state. And if you put 100 of them in a room, they'll come up with at least 100 views. They may come up with some things they agree on, many other things they wouldn't. At some point, though, this is not a university exercise. It's not an academic exercise. It's not someone's doctoral thesis, even though it might be the 3rd or 4th one that they've done. At some point, you've got to call it and you've got to say, right, this is the plan, let's get the job done. Otherwise, you would literally have an ongoing, almost endless academic and theoretical debate. This is not a controlled trial. This is live, it's happening, and at some point you have to make that call. Now, having said that though, we've been pretty clear that actuals beat assumptions. Data, actual real data, beats modelling every single time. So as every day passes, we input real data, real chains of transmission, patterns, any other information we've got, and then the model will be run and rerun again. And if we see a step change, if we see, flip that, a stubbornness that is more significant than we thought, then of course we reserve the right to go and say, okay, what's the epidemiology of each individual case, noting that an outbreak in one household that you reckon you've got completely locked down, it could be 6 cases, but it's not the same as 3 or 4 mystery cases in 3 different parts of Melbourne that at least have one other case for each of them, maybe 2, and a whole network of close contacts. So the modelling helps you make a decision, but then you monitor in real time, and the actual data will always trump any assumptions that you've put into that model.
How hard and fast is the plan?
Well, it is a clear roadmap of safe and steady steps. But, for instance, we haven't put a date on when regional Victoria will take its next step or steps, and we didn't subset regional Victoria into 10 different regions because we knew that it wouldn't be 6 or 8 weeks. They're on the cusp. They're on the cusp of those targets now. Community transmission is obviously an issue as well. You've got to make sure you haven't got any of those cases, but regional Victoria will be able to take at least a step and maybe 2 quite soon. But we've also got to be ready for that with workplace safety plans, with all the enforcement that will have to go on to make sure that we're not, again, for the purposes of being popular, letting people go back to something approaching a COVID normal in regional Victoria only 2 weeks later to find that we've got cases, we've got a problem. That's the really difficult balance here, and the tail of this is stubborn, but the lag. What I do today, I and the rest of Victoria won't see the impact of, the problem potentially of, for 10 to 14 days. That's the other wicked nature of this thing.
Is it possible to say with any certainty that lower case numbers are linked to lower testing numbers? What we've been seeing the past few days, it's higher today on both of those measurements, and therefore should we be not quite as happy with those days of 40s and 50s? No,
I wouldn't say that because, and I'll get you the exact data. I haven't got it with me now, but the percentage of positive cases to tests taken, that's the real key. So you could see testing numbers drop so low, but you're finding so many positives. That's when you know that you are not testing enough people. We've remained above those thresholds. We remain above the World Health Organization threshold as well in terms of how many people you should be testing to get a decent picture. But at the same time, you've got testing that is as much that's about finding the individual cases. You've got sentinel testing, which is about trying to give you a picture, is there something you're missing beyond any one person? And then you've got the stuff we've been talking about today in terms of wastewater that gives you an aggregate picture beyond that. I've got no advice, James, that these numbers, the test numbers are at a point where we don't believe they are a reliable proxy for how many cases are actually out there. But having said that, what we know is that not every single person who's got symptoms is coming forward and getting tested, and perhaps you can never ever achieve that. We also know that with a number of people, there'll be no symptoms hardly at all, or symptoms so mild that you can't even register them. They're at that kind of the asymptomatic positive who can be particularly infectious. They don't know that they're infectious. So that's some of the other challenges we face. It's silent. It's all too silent, and I think we all know how fast moving it can be.
And is there anything hard, sort of as far as hard data, that goes to some anecdotal stuff that maybe people are putting off getting tested until it's more convenient for them? So, for example, beautiful sunny weekend, I've got a runny nose, I'll wait till Monday.
Well, it's challenging to draw those conclusions. Although, if you were to chart this, so let me go back. I'm not someone who comments on the weather too much, but I have had cause to reflect that a really nasty winter's day is terrific for limiting movement, not so good for getting people to come out and get tested. Good weather, and particularly on a day perhaps when people were very much tuned into a device or a TV to get an idea of what the roadmap would look like. Maybe all of those things make it a little less likely that people go and get tested. I can get you some numbers on what we call exposure days, so the number of days that you were symptomatic before you got your test. Try and give you at least a broad range of that. That's why we say to people, and you will have noticed there's a bit of a shift in our language 2-3 weeks ago about not just getting tested, that's critically important, but getting tested as soon as the symptoms start. Because if you do wait till Monday, and this is exactly the point about opening up too soon. If you wait to the Monday, that's not a good thing. I'm not advocating that. But if you wait to the Monday and you're at home, then obviously the number of people you might infect is infinitely lower than if we were to say, oh, well, we want it to be over, so we'll pretend it is. Let's open the whole place up. And that one-day delay might mean that you come into contact with 50 or 100 people. The Colac example, and I congratulate the Colac community and thank you for coming forward and getting tested. I thank the contact tracing team down there out of Bowen Health. They've done a fantastic job. But that's one person, 25 positives, it's like three or four days. That's how wildly this thing moves.
Remy, can I just ask about
Yes, you can.
the modelling again? You were saying before that as the case numbers go down, things like contact tracing get better. The last couple of weeks,
Well, I wouldn't say better. I wouldn't say better. I think the task
Easier.
obviously, well, maybe, and again, but I wouldn't say it was ever easy. But it's obviously easier to chase, say, 50 people who've got it, and on average 3 to 4 contacts per, so a couple of hundred, 250 people who are the close contacts. That's obviously a much easier task
Indeed.
than if you're chasing 700 and 3,000 close contacts.
And the last couple of weeks, you've announced some changes to our public health response, like the local teams yesterday, Ellen Finkel coming in, the new technology we've signed this week. The
Yep.
modelling essentially assumes that in November or December, by Christmas, that our public health response is as good then as it was in August when the modelling was done.
Sure.
So did you essentially present Victorians a worst case scenario when you gave them that modelling?
Well, some people have chosen to use that phrasing, and I have made the point that the worst case scenario is being open for just a few weeks and then being closed again. That's what I regard as the worst case. However, if we'd done differently and we'd said, let's assume what could be argued to be unrealistic improvement, not just on that area, but in any area, well, then your question would be, how confident are you that you can deliver those improvements? Mm-hmm. You've always got to have, I think, not just, conservative's the wrong word, you've got to have a realistic approach to these things. There's always more out there than you think. With so much community transmission, you know what you know, and there's going to be mysteries out there. That's the nature of mystery cases. And some of those will never be closed out. Some of them you'll never be able to track back with any degree of certainty. to say, here, this is no longer a mystery case. I can attribute this to the following circumstances, the following setting, the following groups of people. You've got to be realistic and cautious, because unless you're prepared to say, let's chase what's more popular and let's just spend all of 2021 bouncing in and out of lockdowns, that's the only way that you can go.
In the question that your government asked the modellers to look at,
Yep.
you didn't even ask them to consider the prospect that our public health response will be better, that contact tracing will be better. You asked them to use the same parameters on contact tracing as what things were like in August. So is that really reflective of reality when you're announcing these things to make contact tracing better, basically assuming it will be the same level in November as it was in August?
Well, I think it's a fair question, but I think my answer deals with it when I add to the answer by saying this. You need to be as realistic as possible. You need to make assumptions that you can have high degrees of confidence you can actually get to the point that you're predicting. But you also need, I think, to appreciate that as case numbers come down, whilst the task in a manual sense, like the number of hours worked, it gets easier, but the margin for error becomes almost zero. So if you're chasing low numbers and you want to keep them low, then your margin for error almost isn't one. So you've got to balance all those factors together. The exact inputs into any model, though, I just want Victorians to be clear. It's not like I sat down and pretended that I was a data scientist. Like, we've got a very large team of people who have put together what they believe to be a robust, dependable, fair representation of many different things that are variable. That's the nature of modelling. That's why it's not one input or 50 inputs, it's 1,000 different factors programmed in. But it also speaks directly to the point that I've tried to make these last few days, that the actuals beat assumptions every day. Data beats modelling every day. And that's why as every day passes, there is there's no question that there is reassessment, there'll be reappraisals. We don't run the model again every day because it takes like a day to run, but we will put in batches of data, actual data, and that'll then test how accurate some of the assumptions we made were and are.
And a lot of people are saying that it makes sense to be more conservative than the other way.
Well, there's no being completely
Would you say
hopeful about.
Conservative using.
I wouldn't. No. Hang on a minute though. Yeah. Look, I think it's very important that we choose our language carefully, because it would seem that some in the community, some, are of the view that a conservative approach, using your use of that term, is somehow a bad thing. Like, do it. Open up, stay open. There's only one way to get to that point. And sort of trying to wing it, trying to say, oh, well, look, the model says there's a 65% chance we'll be closed again. Well, that's a 40% chance that we won't be. So let's go with that. I don't think anybody would be particularly pleased if faced with that modelling, I'd made a different choice, albeit a more popular choice. But just like the opening up, I don't think the popularity, if you were someone who was guided by that, it wouldn't last very long, because you'd have to stand here and say, well, even though the modelling told me I shouldn't have done it, I yielded and we opened up, and now I have to shut you down again.
The question is about what the modelling showed you. If the modelling says there's a 65% chance we're closed again by Christmas, that rate might well be lower, experts have said, if it took into account improvements in areas like contact tracing or public health.
Yeah, and as I've said to you though, as I've said to you though, we have an amazing medical and scientific community in this state. I'm very proud of them. I know many of the people who have got a very different view to me, and a big team. It's not just one doctor or one premier. It's lots of people who've worked to deliver that model and lots of other modelling along the way. The key point here though is you can have differences of opinion. That's fine, but at some point you have to call time on it. And you have to say, we can't have an endless debate about the inputs into a model. This is live. It's not a trial. It's not an academic paper. It's not a doctoral thesis. It is a strategy in safe and steady steps to get the place open, with as little risk as possible that we have to close it down again. That will be informed. And another thing too, they're not stone tablets. It's not set. It's not static. It'll be updated, rerun, and assumptions we've made will be able to be replaced with actuals, real case numbers, as well as the impacts of different behaviours as they change in real terms. Particularly given that some parts of the state, particularly regional Victoria, will be well and truly ahead of the settings here in Metro.
Just on today's cases.
Canberra this morning, showing that on June 24, Andrew Crisp wrote asking for 850 personnel to assist in the management of hotel quarantine, noting that Victoria has exhausted internal or contract sources across emergency agencies to fulfil these roles. It also says that ADF personnel in other states have proven to be uniquely suited to roles and functions being carried out within the current environment. That was rescinded a day later. What changed in that 24 hours?
Well, I've been asked this question a couple of times.
And to the wording though.
Yeah, sure. Well, I've been asked the question a couple of times, and I think large slabs of the wording were put to me at the time. While that letter was being written, while that request was being considered, the government was, and many of its agencies were considering alternative arrangements, and it effectively got superseded by events, because it was only days later, basically at the same time, that we decided that those who run our jails, that Corrections Victoria should reset the program. That decision was made, and therefore there was no need. So that's the start and the finish of it, which I think is exactly the same answer I provided when last I was asked.
Just on today's case numbers, we've seen a 50% increase from Monday to today. Usually we do see a drop in cases on Monday and a spike on Wednesday. So should people who are worried about that today not be so worried?
No, I'd make a couple of points, Bridget. You are right to point out that there are a few patterns and trends throughout the week. So I don't think this is at odds with that. The second point I'd make is that percentages can be a little bit misleading when you get down to numbers that are as small as this. We'll get to a point where to go from one case to two would be a massive statistical jump, when in fact it isn't. So as the numbers get smaller, as the strategy works, we've just got to be careful about how we measure that. The other thing too is that we have 14-day averages for a very valid reason. It's about finding a trend over a 14-day period, not pinning every setting and all your hopes on one particular day, given all the variables that we know. That's why, for instance, if I can just make the point further to Michael's point, when we get further into this and we have to make judgments on the 13th and 14th day of a 14-day period, if there's an outbreak, if there's a report, if there's a spike in cases on that given day, or in the 2 or 3 days before the end of that relevant interval, then we would look at the unique circumstances of those and we'd have to make a judgment about how confident we are that we have essentially contained it to just those people. That's the common sense that goes along with this all the way through. If there was another way that didn't absolutely make it likely, in fact more than likely, that we had to lock down again, I would have chosen that path, and everyone would be happier, and we wouldn't be having this sort of debate. I just want to be really clear with all Victorians. The notion of some other far easier, far quicker opening up was not an option. It was not an option. If it had been, we would have chosen it. That's just the fact of these things.
Do we have any idea where these cases are from today? How many are linked to known outbreaks? It is hard not to be disappointed with the numbers today.
Well, no, I'd say to all Victoria on the question, Cho released later on today, I'll give you as much information as we possibly can. I would say to all Victorians, this number's higher than it was yesterday, but the trend is with us. The numbers are falling. We're getting down to very small numbers. We've got to be smaller still before we can safely open up and stay open. That's the key here. There is simply no benefit for anyone. Unless a restaurant can, do a year's worth of work in 3 weeks, doesn't make any sense. Being open for just a few weeks and then being closed again, that's not a strategy. It could be popular for a short while, but that's not my concern. Whether I'm criticised or I'm praised, this is about doing it right, not doing what's political or popular. And if that's just the way it is. I'm trying to be as frank and as clear as I possibly can be.
When will you announce more financial assistance? And also, do you have any information on how demand for mental health services is going? Are they keeping up?
I'll come back to you on mental health demand. Obviously, we know we made some announcements very recently in terms of a significant boost to further fast-track some of the interim recommendations of the Royal Commission. That was everything from counselling services for kind of high prevalence disorders that are of a lower acuity level, all the way through to some more acute mental health beds. You've got a number of different groups. Some people who are experiencing mental illness for the first time, some people who have a mental health condition and it has been made worse by the situation we find ourselves in. We're trying to make investments in all of those different areas. I can come back to you on in terms of the kind of demand trends, but I certainly haven't had a spike or any step change brought to my attention in recent days. In terms of financial assistance, economic support, we'll make those announcements quite soon.
How many Victorians are on JobKeeper, JobSeeker, and where? Do you have any idea how many Victorians are relying on JobKeeper?
No, I would need to come back to you, and of course those numbers will change once we get to that next trigger point. In just a couple of weeks, where we'll have 101,000 people who are currently prohibited from being at work. They will be able to go back to work in those industries that we've outlined, and of course those numbers would change progressively. Of course, regional Victoria will be the other one where, depending on whether it's one step or two quite soon, there's potentially a range of people who are off work who will then be back at work.
And where are negotiations with the federal government or talks with the federal government at in terms of assistance and ongoing assistance for Victorians?
Oh, look, the government speak, officials speak. I'll be having some conversations with the Prime Minister later on this week, and it is best, I think, that I have those conversations with him rather than kind of broadcasting my message. I don't think that necessarily achieves anything. As I said, I'm not interested in at all in the politics of this. I'm just not, because it doesn't work. It doesn't work. Politics is of no use in the fight against this virus. That's always been my view, and that won't be changing.
Those who are trying to sell their homes right now due to financial pressure, they can't have an inspection, let alone an auction. When can they start to expect that they might?
I haven't got the roadmap in front of me, but I'll find out when we expect that we can have those inspections and open houses, inspections and auctions back as looking closer to a normal. It's not next week. It needs to be for safety reasons. When you think about it, there are many people who attend auctions. There are many people who would see themselves as there to bid. There are then, we had a house sell in our street not long ago, prior to COVID, but so it is a long while ago actually. There were a lot of people there who had no intention of buying the place, could never have been registered, but turned up to have a look. And all of a sudden, you've got a gathering that is way too big and way too risky in terms of spreading this virus. I know it's not easy. I know there are many in the real estate community and vendors and people across the state who would love different settings, but a bit like pubs and cafes and restaurants, they wouldn't be back to normal for long. Got to find that long-term normal and then lock that in.
Like pubs and cafes and restaurants, scrap auctions. What if you could have inspections where at least people could come along and leave their details with their mobile numbers and their names?
Sure. Let me come back to you. As I said, I haven't got the document in front of me now. There's a lot in it, but I'll get you an answer on when we think that will be able to happen. It did come back. It did come back, but of course circumstances changed.
And are there any hardship exemptions on that? Can people apply, like say if they're in real financial dire straits, are they able to apply to some way, they can have a few people come over, look at a house and sell a house?
Look, there are exemptions available to many of these rules, and we've always welcomed people making their case, and there's a whole team that deal with that. And they're many and varied. Obviously, they're as varied as you can possibly imagine. On the specifics of that, I'm not sure whether we've had anybody come to us arguing that, but I'm more than happy to ask. And
just another bit of clarity, just singles. And forgive me if you've answered this before, but if I'm...
We're not going back to where I was yesterday.
But the single who connects with...
Samaya's not here to moderate our discussion.
The single that connects with the household, they feel that it's unfair, and is it the case, does everyone else in the household need to clear out? Are they only connecting with one person?
That is the advice at this stage.
And why is it different?
Well, it's different in terms of the fact that it will be a large group of people. It's different because we're at a different phase. When we did intimate partner arrangements way back when, we were in a different set of circumstances, and I think you get to that point where, not to get too much into the weeds, but you get to the point where, okay, should we change up those rules for intimate partners? And I think the decision was made, no, we won't. But this is a new thing. This is over and above the arrangements that we've had in place.
I only ask because Brett Sutton appeared on the radio yesterday to sort of talk about some change, and maybe that change might have been around the mask rule. Is that correct?
No, it's not the advice I've got.
Okay.
That's not the advice I've got, and I think I went into some detail yesterday about why masks were possible with one type of connection and less possible with others.
So, sorry, if my mate who lives alone comes to visit me, my family has to leave?
Or he doesn't nominate you as his person. He finds someone who doesn't have a family that would need to leave. So it's about trying to connect without dramatically changing the risk profile. You can't... Yes.
So James's girlfriend came to visit him, his wife probably wouldn't approve.
I'm certain. I will make a pronouncement. I make very few from this podium, but I will make a pronouncement, London, that James's wife would be very upset if his girlfriend came around to visit.
But his family wouldn't be required to leave. So what's the difference there?
Well, one is a set of arrangements that have been in place for a long time. Others are new. Again, we will try and make sure that these rules are as sensible as they possibly can be, but we're trying to mitigate risk. And the notion of a person going into a very large household when they previously could not do that, going in, it's new, it's extra, it's over and above. I don't think there's been that many intimate partnerships that have been formed over these last few months. This is new, and it's over and above all the other arrangements we've had in place. The notion of someone going into a large household, there is a risk. So as much as possible, we would want that to be a single person connecting with somebody else, one-to-one, where they can get some of the dividend of being able to see other people, some of the really powerful benefits of being able to connect with somebody else. As I said yesterday, I think some of the comparisons with intimate partner provisions, they don't really hold up.
There's been about 9 new cases in Queensland today.
Not that anyone's suggesting that you have arrangements any remotely like that, James, just to be very clear. Well, I didn't want to interrupt Lundy, he was in full flight, but
I thought
yes.
it got as silly as it was going to yesterday.
Well, I just stand here like it's...
There's been about 9 new cases in Queensland. What does that tell us about how difficult it's going to be to get to those final thresholds of the roadmap and people who might think they're too high?
I just want to... I know there's been a bit of commentary about that, but this is the key point is this. Like, and it's very easy for people to run commentaries about, oh, this is not a suppression strategy, you're trying to eradicate it. That's absolute nonsense. Because an eradication strategy isn't just getting to zero, it's staying at zero. And the moment you get one case, you lock the whole place down again. Look where New Zealand is at. That's not the strategy. But in order to have confidence, and just think, this is just absolute logic, in order to have confidence that you can keep numbers low for the long term, you need to get numbers low as you possibly can. And then you can have some confidence that off that very low base, particularly as it relates to community transmission mystery cases, logic just tells you you're always going to have a better chance of keeping it contained if you've truly contained it. But the sort of New Zealand strategy, that isn't just about where you get to, it's about what you have to maintain. And the sensitivities there, the tolerance is pretty well zero. So that's why when they get a very small number of cases, they've got lockdowns back on again. I'm not criticising them, but that's a different strategy, a different setting. That is not the National Cabinet decision of our country. And I'll refer you to the Prime Minister's comments only a few months ago that very low to no mystery cases was a critical component, a very important component of the National Cabinet strategy.
Are you able to confirm today that it was in fact police who asked you to impose the curfew?
No, I wouldn't confirm that at all. I think there was a discussion. There was a discussion between different parts of government. We've spoke with police, absolutely. Police,
But
I think
where
in
did the idea first come from?
Well, I
Who
think...
first proposed it?
Oh, look, I'm not wanting to be anything other than clear, but I can't pinpoint the individual on the day when they said, oh, let's do this. I think there's been an ongoing discussion, right? just to be as clear as I can be, there's been an ongoing discussion. Every time we make rules, police will give us feedback on how hard or easy they'll be to properly enforce. And you would expect nothing less, that we have that ongoing discussion. Once you limit the number of purposes, the number of reasons that you are allowed to leave home to a very small number, then the easiest thing to do to enforce that, not easy at a personal level or, we've never done it before, but the easiest thing, just if you be completely focused on the kind of operational side of it, the easiest thing to do is to say, okay, well, if you haven't got one of those reasons, you're not allowed out. So at the moment, if you wanted to go exercising, you can't. If you wanted to go shopping, you can't. If you go to work, you can. If you're a permitted worker, you can go and do that. So this is about limiting movement. The health advice says limit movement. Police say they need clear rules to be able to enforce. Curfew delivers both.
It's such a radical step for Victoria.
But a very, very effective one, Laurel, because it has limited movement, and that's what drives down case numbers.
Do you not think Victorians deserve to know where that idea originated from and what the process was?
What I'm saying to you is I can't give you a specific person and the exact moment that they said,
because you
let's
don't
do
know,
this.
or you won't tell us?
No, it's because I can't tell you. I don't know exactly which person at what moment said that. But there's ongoing discussions, lots of different people talking, both us as a government, officers, so senior officials, members of Victoria Police. It's no more or less complicated than that.
Did Brett Sutton advise you that you should do it?
It's not a matter for Brett Sutton. That's not a health advice. That is about achieving the health outcome. His advice is do whatever you can to limit movement. Police then say we need rules we can enforce. It needs to be as simple as possible. We can't stop every car, but if everyone who's out that shouldn't be knows that there's a chance they'll get caught and they've got no lawful reason to be outside, that's what a curfew's about, then all of a sudden you will limit movement. So it's consistent with the health advice. These are decisions ultimately made by me. So the answer to the question is, if anyone has got a problem with that, anyone who doesn't think that that has limited movement and driven down cases, well then their argument's with me. Because I've made that decision, because I think it's a challenging one to make, but it's effective and it works. And what it means is, if you wanted to go exercising at midnight, you can't. If you want to go shopping at midnight, you can't. If you're a worker and you're permitted, you can. If you need urgent care, you can get that care. Beyond that, what it means is no one's sneaking out going to their mate's place. No one's going and doing things that they are by law not allowed to do. So it hasn't changed the rules. The rules, that is, the reasons you can leave, they're all the same. It just makes the job of police much, much easier.
But you said, and I think Brett Sutton said on radio yesterday, that it's a state of disaster provision, but it is also written into the Chief Health Officer directions.
Yes.
So was Brett Sutton just told that was the way it was going to be? He had
no, I wouldn't read into that. There's a whole lot of interplay between the directions that are made under the Public Health and Wellbeing Act, pursuant to the powers of the state of emergency, pursuant to the powers of the state of disaster. That's quite a complex set of arrangements. But it's all about health advice, limit movement. Righto? Police then say, these are hard rules to enforce. We reckon there's a bunch of people that are out and they shouldn't be out. Give us the clearest, simplest set of rules you can. And a curfew that says, unless you've got a lawful reason to be outside after 8, soon 9 p.m, out to 5 a.m, then you can't be, is much easier for Victoria Police.
So if the rule is in place to stop people going to those little gatherings, sneaking around, does that essentially mean that the rest of Victorians who you say are behaving really well are basically being punished for the behaviour of these smaller numbers of people?
But why are they being? Hang on. Under that, your definition of punishment is not going for a jog at midnight or going to the supermarket at 10 p.m. That may be a burden for some people, and I apologise for that. But the benefit far outweighs, in my judgment, the benefit far outweighs that burden.
The benefit of stopping a small number of people sneaking around.
But that's what rules do, though. That's what rules do. The vast majority of people do follow the rules, and I thank every single one of them for doing it. We have. I can lay out all the laws of the state, and I'll stretch from one side of the room to the other, and they're usually for the minority of people. They're not for law-abiding citizens, and those who do the right thing. They're for those who don't.
But there's quite a difference between telling people not to gather in more than 10, because that limits your close contacts. People follow those rules, versus making rules that apply to everybody when in fact they're aimed at a very small number of people. How is that fair that everybody in Melbourne is affected by the behaviour of a small number of people?
Because if no, hang on, that's with the greatest of respect, that's not the greatest analogy that you could draw. If everybody gathered in groups of 10 in the midst of a second wave with community transmission as wild as it was just a few weeks ago, this will end no time soon. So whether it's directed at a small number of people, whether it's directed at a larger number of people, ultimately everybody benefits by getting these case numbers down, opening up in a safe and steady way and being able to lock that normal in. That's the absolute key to this.
Premier, I have a couple of regional questions.
Sure, no worries.
You've already touched on this, but there's no date for the regional state 3 to go with
Correct.
the case numbers.
It'll be when we reach that target and when we've got confidence that those numbers are meaningful. So just as a little caveat, but and the reason that this goes back to the point about we didn't divide regional Victoria up into 10 regions, say, and I appreciate it. Like I get the daily phone call. Don't worry about that. I get sometimes more than one. From a community. My mum lives in a community where there's been either no or very few cases. There's no active cases there. I get the call. You know, that's fine. I appreciate that there is frustration there, but it's not like we're asking those communities to wait for 8 or 10 weeks. We think we'll get to those numbers, which are low and they are cautious, because we don't want to have a massive problem in regional Victoria whilst we're trying to deal with the challenges we have in Metro Melbourne. That would be really, really difficult. We'll get there soon, and hopefully it isn't just taking one step, hopefully it can be taken two.
But can you see how not having a date on it is generating some concern that you're looking to push it out as long as possible?
No, that isn't the aim at all, and I think that concern, James, I'd be indebted to you and to your network. We would be absolutely indebted if you were to point out to every single regional Victorian that the current average is 5. So the current rolling average is 5, which means we are incredibly close. If we can continue these sorts of case numbers, then we will get under 5, and the 14th day will be upon us, and we'll be able to make some significant announcements.
And linked to that, given those numbers are so low in the regions, is there a possibility that schools may be able to go back when term 4 is meant to begin on the 5th, rather than having to wait for the 12th?
Yeah, I think there was a view. So there's issues around seniors, the GAT, and a few of those things, and then there's also, I think, that notion of having to reset because they've been away for a period of time. I'm happy to follow that up though. I don't know that there's any. I'm not announcing that that's a variable thing, but I think it was just one of those things, like we did last time. So give people the time to kind of reset, because even under all schools, all year levels open, I think school will look a bit different with some of the lessons that we've learned over time.
Premier, you said outdoor dining will be a big feature of opening up.
I think so, yeah.
What do you say to those businesses where outdoor dining isn't really practical?
Well, what I'd say is that there are those businesses that you refer to can probably be divided into a number of different groups. And I think I went to this with Michael Rowland the other day, but I'm happy to go back through it again. There'll be some businesses that, because of local council rules, they can't use the footpath. There are some businesses that, because of other rules that go well beyond local government, there's curbside parking, for instance, so you can't use that space. There are some businesses that are directly across the road, a series of restaurants and cafes, there might be a park that they can't access. We are going to make some pretty aggressive decisions about freeing up as much space as possible. You will see roads and laneways closed. Not everyone, but where it's appropriate, you'll see them closed. You'll see parks that will become a centre of not just passive rec, but you'll see people drinking and dining in those parks. Not every square inch, but where that's appropriate and where we can share that. You'll see curbside parking gone in some streets, and restaurants and cafes and pubs being able to occupy that space. We've spoken with London, we've spoken with New York, we continue to speak with a number of other big cities around the world, directly into the Mayor's office, into other senior officials, and we think that can be part of our mix. So I would just say to business, it's not like only those who've got a very limited number of tables out the front today under the current rules, under non-COVID rules, I mean council rules, that's the only space you'll have. We're going to change that up a lot.
And if businesses along the Great Ocean Road say they don't have infrastructure to safely go al fresco, particularly with summer tourists. They want the state government to pay for marquees and that. Is that something you're considering?
We will have more to say about how we can support businesses. That is there's a few different things we can do. There's obviously changing the rules, so allowing outdoor dining where it wouldn't be permitted. That's one thing that we can do. We have the ability to do that and do that pretty quick. We're not going to be wasting any time with that. We'll make that decision for and on behalf of others. And then there's some other things about trying to support. For instance, if you go to New York, there's a whole bunch of cafes that are now out in the curbside parking. Some are in streets. Some have taken the entire footpath, and the footpath has been moved into that curbside parking. Bollards have been put up, barriers, dividers, and then between each table there are A-frames with a Perspex screen. All of those things are possible, and all of those things will be supported by us. We understand there's a significant impost to do that, and it's not like we're going to give people a set of rules that they couldn't possibly afford to use. That wouldn't make any sense.
Is there any option to do the same thing for things like gyms, Pilates, yoga studios? They're also probably the last to come back.
Yeah, potentially.
Could they be?
Well, under the road,
camp in a park,
well, under the roadmap, there are some outside personal training, boot camp type activity that's back on at various points. I'm always happy to look at, and that's what industry consultation is all
around that waiving of the local council laws, because there are limits at the moment on parks and boot camps. Would you waive some of those laws to allow people?
Always happy to look at it. Always happy to look at it. And again, that shouldn't be taken as a criticism of local government. Those rules may serve a perfectly worthy purpose, but when you're in the midst of a pandemic and you're looking to get as much economic activity as you possibly can, then we will seek to change those rules for a period of time. I'd fully expect, Raf, that when some of this happens, and I think it will happen quickly, and it will be very, very popular, and I think it might well change large parts of the city and suburbs, not just for the pandemic, but for the longer term. Now, having said that, I don't expect any publican to think that that's a better outcome than having people inside, right? I'm not expecting that, but it's a much better outcome than being closed. And that, in turn, is a much better outcome than being open for 5 minutes and then being locked down again.
What's the timeline, do you think, for the state of disaster? When do you see that being extended with the state of emergency quite regularly, or are we almost at the end?
For as long as we need to. And that gets down into sort of fine details about clarity about enforcement, things of that nature.
A question about testing and reporting of results. In the testing stations that are being run by contractors, apparently the labs report results to the contractors first, not direct to...
I happen to have the testing commander standing just beside me, so I feel confident that he'll either answer it or take it on notice with greater eloquence than me.
Say again, James?
So, where contractors are doing the testing, the labs report the results back to the contractors, not direct to the department. There's that extra reporting step in there. Is that correct?
Yeah, so we have, as I said, around 210 testing centres across the state. Many of those are run through our community health services and local health services. We have around 15 major retail centres that are run under a range of subcontracting arrangements. The data for all of those retail centres goes into our direct pathology providers. The pathology providers provide the answers straight back into the Department for Health and Human Services. They also provide results to other stakeholders.
So there isn't that intermediate step.
There's no delay in getting results from the pathology labs into the system, so we can get on and find the positive cases.
Also, apparently the contracts for providing those testing services haven't been posted online anywhere. When should they have been?
I'll take that on notice.
Can I ask Premier one more question?
Just one more question.
I've got one more too.
Very, very good. Michael, yes.
Just on the curfew again, just can you clarify whom and what is exactly targeted at? Because you said before, word for word, that part of it is to stop people sneaking around. Can you clarify why that curfew is in place and why it's going to be in place for several weeks more?
Ultimately, I'm trying to be as simple and as clear as I can be. There are a very limited number of purposes for which you are allowed to leave home. If you are wanting to go out, to have a beer with a mate, to go to a party, go and do whatever else, that's not allowed by law. So that's whether there's a curfew or not. That is not appropriate, that is not permitted. In order to make the job of police much, much easier, to stop that behaviour and any other behaviour that involves movement. It involves unnecessary and indeed unlawful movement. We've got a curfew in place. No one's pleased to do that, but there's no denying that it has limited movement, and the movement that it has most limited is movement that is not lawful. As I said to you before, exercise. You're allowed to go exercise for an hour. Now, some people, I'm not having a go at them, they might choose to go and do their exercise at 11 p.m. at night. Well, that's not allowed. They might choose to do their shopping very late at night, and that wouldn't be allowed either. And of course, principally more because many big retail sites have in fact closed. But in terms of the benefit, the reward for having limited movement, and you can see it in the traffic data, you can see it just anecdotally. Anyone who is travelling around for lawful purposes, whether it be coming home from work because they're a permitted worker, you can see it. You can see it that it is absolutely driving down movement, and driving down movement drives down case numbers and then allows us to get to the place quicker than we otherwise would, where the curfew can come off and where we can get back to that, find that COVID normal. It's nothing more or less than that.
The question here is about proportionality, though, isn't it? It's that to stop movement, you could simply make it illegal to leave your house for 24 hours a day. To put a curfew on is quite a big impost on the lives of lots of people. So is putting that curfew on and stopping that movement?
No, I'm sorry. I'm not trying to be anything other than helpful, but I'm not following the comparison. If you're putting it to me that it would somehow be better to tell people that they were locked in for 24 hours a day.
What you're saying is that we're trying to stop as much movement as we can.
Unlawful movement.
Unlawful movement.
Movement that is against the rules.
Do you think people, if they want to go out and be unlawful, they would just do it before 8 p.m?
And no. If you want to go out and be unlawful, now police have got the easiest set of arrangements they've ever had to catch you and fine you. That's what a curfew delivers. Simple.
Just a quick question from...
Doesn't change the reasons for which you're allowed to leave, other than the exercise one, as I indicated. And if you think about the benefit in terms of curtailing movement and driving down case numbers, I think that far outweighs the inconvenience of that. It's a loaded term in some ways, and it's not something we've had to do before, but this is not an ordinary year. This is 2020. And I think things that make it easier, if I could speak on behalf of those who are doing the right thing for a moment, things that make it easier to find and penalise people who are doing the wrong thing, I think that would have very significant support amongst people who are doing the right thing. It's not there forever. It'll be there for as long as it needs to be. I believe it's proportionate to the risk, and it's proportionate to delivering, and critical to delivering this strategy. So the curfew can come off and be accompanied by you having many, many more reasons to leave your home.
Well, the Ballarat mum who was arrested in her house and charged with incitement, she's asking for an apology directly from you because she claims she doesn't feel safe.
Well, that matters.
Expecting one?
That matters before the courts, and I'm not going to be commenting on it until it's dealt with by the courts.
No interest in an apology to her?
Well, as I said to you, that matter is before the courts, and I'm very proud to lead a government that has done more than every other government in this country combined to deal with issues of safety for women, but that matter is before the courts, and I simply am not able to comment on it.
Premier, former Labor Cabinet Minister Stephen Conroy referred to your Chief Health Officer as a clown and said he needs to stop doing media and start reading files on his desk. What's your reaction to that?
I don't have any reaction to that. And if I started to have reactions to every commentator out there, I wouldn't get to too many of the files on my desk.
Will the Western Australian nurses who have COVID or in isolation in Melbourne, will they be allowed to leave early if Western Australia charters them out on a plane?
I'm not sure about that, but I'm happy to follow it up for you. Obviously, we're very grateful to other states, including the great state of WA, for their support. I speak with Mark often, and very, very grateful for his support. And we wish those nurses well. They've been doing the best of work, and some of them have got sick. Much like any other health worker, regardless of which state you come from, we're very, very grateful to every single one of them. I'm happy to chase that up. I think the bigger barrier will be at the other end because that border's closed. But I think the Premier of WA has made it clear that there may well be a way to get around that for these very small number of people.
So they might be able to leave the 14-day isolation early?
Yeah, look, let me come back and check. It depends on their exact status, I think. Positive versus close contact, how recent the test, symptoms, all of those things.
There's a significant black market now developing, people getting illegal haircuts and beauty services.
So I've not accessed that.
What
There
is
was
the
some
plan for
speculation
your
earlier in the
own
week that I
cases,
perhaps had a haircut. I can confirm for you that has not happened.
Does Kath need to get out with the clippers?
No, I don't think so.
What can be done to police things like that black market?
Well, look, anybody who's breaking the rules runs the risk of being caught and being fined. And if it were the case that you were doing that on a repeated basis, then you would probably, be a matter for police, but you would probably get the higher fine. You probably wouldn't get the $1,652 fine. You might get the much, much higher one. So, again, back to Michael's point, the rules are not there for any other reason than to get us to that COVID normal and for us to be able to lock that in. And on behalf of the government, I want to thank every single Victorian, which is the vast majority, who are doing the right thing. I'm very proud of them. There will always be a smaller number of people who don't. And sometimes that's really quite, that's not as obvious as it might be. Maybe it is people in someone's house visiting, doing things they, gathering as they shouldn't do. Sometimes it's people in an act of real selfishness going out and protesting at, of all places, anywhere near the shrine. That shouldn't take away from the amazing work that the vast majority of Victorians are doing. So my advice to those people is I don't think that's a very smart choice, because you will get caught and then police will have no choice but to fine you.
Can I just ask about the spread of the virus? At the start of the kind of second wave, at the start of July, it was kind of quite small amounts spreading around different areas of Melbourne, hard to pick up. How do we know that that's not the case now or won't be the case going forward? And is that threat kind of part of the logic behind the really progressive and steady roadmap out?
No, I think the logic behind the safe and steady opening up and the advice that sits behind that is a fundamental acknowledgement that this thing moves silently and rapidly, and you only ever know what you know, because not every single person who's got symptoms gets tested. You've always got to assume there are more cases out there than you might be reporting on any given day, and the assumption has to be as realistic as possible. Whether it's described as conservative or otherwise, I'm not too fussed, to be honest. It's cautious. Do it just the once. That's our plan. Have a situation where you can open up and stay open. It's nothing more complicated than that. Any other issues?
Thank you.
Very good. See you tomorrow.